Here we have MRI of the thigh in 35-year-old male with proven diagnosis of SAE1 dermatomyositis. To give some background story or background history of this particular disease, especially for the radiologists. So this is an autoimmune dermatomyositis, and NTSAE1 is highly specific for this type of dermatomyositis and is present in about 5 to 8% of European population with dermatomyositis. There are other autoantibodies as well, such as anti-MI2, anti-MDA5, anti-TIF1, and anti-NXP2, to name a few. The chief findings will be erythema, periorbital edema, rashes. Patients may present with mild myopathic features. They can also present with dysphagia, fever, weight loss, respiratory symptoms due to interstitial lung disease. This patient presented to the hospital about 5 months ago with periorbital edema, and the MRI at that time showed mild edematous change in the eyelids. Now the patient has presented with increasing thigh and leg pain. So what we have got here is bilateral symmetrical diffuse increase in the signal in bilateral gluteus minimus muscles and also in the iliacus muscles bilaterally fairly symmetrically. There is also bilateral asymmetric abnormal signal in the superficial aspect of the lateral vastus lateralis muscles bilaterally. The findings are consistent with acute myositis. On T1 sequence, there is no evidence of muscle atrophy or fatty atrophy of the muscles. So, in summary, here I'm showing a case of acute myositis in a proven case of dermatomyositis with anti-SAE1 antibody.